Question 1. A prescriber writes for lisinopril 10 mg POQD. The patient's chart indicates a history of bilateral renal artery stenosis. Which of the following is the most appropriate action for the pharmacy technician? A. Process the prescription as written, as it is a common medication. B. Inform the pharmacist about the patient's medical history and the prescribed medication. C. Dispense the medication and advise the patient to monitor for side effects. D. Contact the prescriber immediately to question the order. Answer B. Inform the pharmacist about the patient's medical history and the prescribed medication. Lisinopril is an ACE inhibitor, and its use is generally contraindicated or requires extreme caution in patients with bilateral renal artery stenosis due to the risk of acute renal failure. While a technician cannot independently question the prescriber or refuse to fill, recognizing potential drug condition contraindications is a critical safety step. Therefore, the most appropriate action for a pharmacy technician is to flag this potential issue and alert the pharmacist for their clinical review and intervention with the prescriber. Question 2. A prescription for amoxicillin suspension 250 mg per 5 ml states to dispense 150 ml. The dosing instructions are 250 mg POTID. What is the day supply for this prescription? A. 10 days. B. 5 days. C. 15 days. D. 5 days. Answer A. 10 days. First, calculate the total milligrams dispensed. 150 milliliters asterisk 250 mg / 5 milliliters equals 7,500 milligrams. Next, calculate the daily dose. 250 milligrams per dose asterisk 3 doses / day equals 750 milligrams per day. Finally, divide the total milligrams dispensed by the daily dose. 7,500 milligrams / 750 milligrams per day equals 10 days. This calculation ensures the patient receives the correct amount of medication for the prescribed duration. Question 3. Which of the following medications is classified as a Schedule II controlled substance? A. Alprazolam. B. Tramadol. C. Codeine with acetaminophen. D. Oxycodone. Answer D. Oxycodone. Oxycodone, often found in products like OxyContin or Percocet when combined with acetaminophen, is a potent opioid classified as a Schedule II controlled substance due to its high potential for abuse and severe psychological or physical dependence. Alprazolam's Xanax is Schedule IV, Tramadol Ultram is Schedule IV, and codeine with acetaminophen, Tylenol No. 3, is Schedule III. Understanding controlled substance classifications is crucial for proper storage, dispensing, and inventory management in a pharmacy. Question 4. A pharmacy technician receives a medication order for warfarin 5 mg PO daily. Which of the following laboratory values is most critical to monitor for a patient taking warfarin? A. Hemoglobin A1C, HbA1c. B. Thyroid stimulating hormone, TSH. C. International normalized ratio, NR. D. Creatinine. Answer C. International normalized ratio, NR. Warfarin is an anticoagulant used to prevent blood clots, and its therapeutic effect is monitored by the International Normalized Ratio, NR. An INR within the target range indicates appropriate anticoagulation, while values too high or too low can lead to bleeding or clotting, respectively. Monitoring INR is essential for patient safety and to adjust warfarin dosage, highlighting the importance of understanding drug-specific monitoring parameters for technicians. Question 5. According to federal law, what is the maximum amount of pseudoephedrine a retail pharmacy can sell to an individual per day? A. 6 grams. B. 9 grams. C. 5 grams. D. 5 grams. Answer A. 6 grams. The Combat Methamphetamine Epidemic Act of 2005, CMA, sets federal limits on the sale of pseudoephedrine, ephedrine, and phenylpropanolamine. It restricts the daily sales limit to 6 grams of pseudoephedrine per purchaser. Additionally, there is a 30-day purchase limit of 9 grams, regardless of the number of transactions. These regulations are critical for preventing the diversion of these medications for illicit methamphetamine production. Question 6. A pharmacy is compounding a non-sterile preparation. Which of the following USP chapters provides guidance for non-sterile compounding? A. USP less than 797. B. USP less than 800. C. USP less than 795. D. USP less than 1116. Answer C. USP less than 795. USP less than 795 provides the standards for pharmaceutical compounding of non-sterile preparations, outlining requirements for facilities, equipment, components, compounding procedures, and quality assurance. USP less than 797 addresses sterile compounding, and USP less than 800 focuses on handling hazardous drugs. Adhering to USP less than 795 ensures the quality, safety, and efficacy of compounded non-sterile medications, which is a key aspect of pharmacy quality assurance. Question 7. A patient brings in a prescription for metoprolol succinate ER 50 mg daily. They previously received metoprolol tartrate 50 mg BID. What is the most important distinction for the pharmacy technician to recognize between these two medications? A. They are different strengths. B. They are different brand names. C. They have different salt forms and release profiles. D. They are used for different conditions. Answer C. They have different salt forms and release profiles. While both are metoprolol, the succinate salt is an extended-release R formulation typically taken once daily, whereas the tartrate salt is an immediate-release formulation, usually taken twice daily a day. This difference in salt form and release profile significantly impacts dosing frequency and duration of action. Recognizing these distinctions is critical for preventing medication errors and ensuring appropriate patient therapy. Question 8. A medication order states, dopamine 400 mg in 250 ml D5W to infuse at 8 micrograms per kilogram per minute for a 70 kg patient. What is the infusion rate in ml/hr? A. 10 5 ml/hr. B. 21 milliliters per hour. C. 5 25 ml/hr. D. 15 75 ml/hr. Answer B. 21 milliliters per hour. First, calculate the total dose in mcg per minute. 8 micrograms per kilogram per minute * 70 kilograms equals 560 micrograms per minute. Next, convert this to milligrams per hour. 560 micrograms per minute * 60 minutes per hour * 1 mg/1000 micrograms equals 33.6 mg/hr. The concentration of the infusion is 400 milligrams in 250 milliliters, which is 16 mg/ml. Finally, to find the infusion rate in ml/hr, divide the required mg/hr by the concentration. 33.6 mg/hr / 16 mg/ml equals 21 milliliters per hour. Accurate calculation of 4 infusion rates is crucial for patient safety and medication administration. Question 9. A prescription for acetaminophen 325 mg tablets instructs the patient to take 2 tablets every 6 hours as needed for pain. If a 10-day supply is dispensed, what is the total number of tablets the pharmacy should provide, assuming maximum use? A. 40 tablets. B. 60 tablets. C. 80 tablets. D. 120 tablets. Answer C. 80 tablets. The patient takes 2 tablets every 6 hours. Since there are 24 hours in a day, this means they would take 24 divided by 6 is equal to 4 doses per day. Therefore, the daily tablet consumption is 2 tablets/dose * 4 doses/day equals 8 tablets per day. For a 10-day supply, the total number of tablets needed is 8 tablets/day * 10 days equals 80 tablets. This calculation ensures the patient has enough medication for the prescribed duration. Question 10. Which of the following is an example of an engineering control used in sterile compounding to minimize contamination? A. Wearing personal protective equipment, PPE. B. Hand-washing technique. C. Laminar airflow workbench, LAFW. D. Proper waste disposal. Answer C. Laminar airflow workbench, LAFW. A laminar airflow workbench, LAFW, is an engineering control designed to create an environment that minimizes the risk of contamination during sterile compounding by providing a constant flow of HEPA-filtered air. While PPE, hand-washing, and waste disposal are crucial for sterile compounding, they are considered administrative or procedural controls rather than engineering controls, which physically prevent or reduce exposure to hazards. Question 11. Which federal act requires that pharmacists offer counseling to Medicaid patients regarding their prescriptions? A. Poison Prevention Packaging Act, PPPA. B. Omnibus Budget Reconciliation Act of 1990, OBRA 90. C. Drug Enforcement Administration, D. Regulations. D. Food, Drug, and Cosmetic Act, FDCA. Answer B. Omnibus Budget Reconciliation Act of 1990, OBRA 90. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, mandated that states require pharmacists to offer counseling to all Medicaid patients regarding their new prescriptions. This act aimed to improve patient outcomes by ensuring they understood their medications, including proper use, storage, and potential side effects. While the counseling requirement initially applied to Medicaid patients, most states have since extended it to all patients, emphasizing the importance of patient education. Question 12. A patient experiences a severe allergic reaction, including anaphylaxis, to penicillin. Which of the following medications would be absolutely contraindicated for this patient? A. Cephalexin. B. Azithromycin. C. Doxycycline. D. Clindamycin. Answer A. Cephalexin. Cephalexin is a cephalosporin antibiotic, which shares structural similarities with penicillin. Patients with a severe penicillin allergy, e.g., anaphylaxis, have a significant risk of cross-reactivity with cephalosporins. Therefore, cephalexin would be contraindicated. Azithromycin, doxycycline, and clindamycin belong to different antibiotic classes and do not typically exhibit cross-reactivity with penicillin, making it safe to administer these alternatives. Question 13. In a hospital pharmacy, a stat order for a medication typically means it should be dispensed and administered within what time frame? A. Within 30 minutes. B. Within 1 hour. C. Immediately, typically within 5 to 15 minutes. D. Before the next scheduled dose. Answer C. Immediately, typically within 5 to 15 minutes. A stat order signifies an urgent, immediate need for a medication, meaning it should be dispensed and administered as quickly as possible, generally within 5 to 15 minutes. This timeframe is crucial for critical situations where prompt treatment can significantly impact patient outcomes. Pharmacy technicians must prioritize stat orders to ensure timely delivery of life-saving or condition-stabilizing medications. Question 14. A patient is prescribed atorvastatin. What common counseling point should a pharmacy technician reinforce regarding this medication? A. Take with food to prevent stomach upset. B. Avoid consuming grapefruit or grapefruit juice. C. It may cause drowsiness, so avoid driving. D. It should be taken only as needed for pain. Answer B. Avoid consuming grapefruit or grapefruit juice. Atorvastatin, a statin medication used to lower cholesterol, has a significant drug interaction with grapefruit and grapefruit juice. Grapefruit can inhibit the metabolism of atorvastatin, leading to increased drug levels in the blood and a higher risk of side effects, particularly muscle pain and liver damage. Reinforcing this counseling point is crucial for patient safety and maximizing therapeutic outcomes. Question 15. What is the Beyond Use Date, BUD, for a non-aqueous compounded preparation if no stability data is available for the specific formulation? A. 6 months or the earliest expiration date of any API, whichever is shorter. B. 30 days. C. 1 year. D. 14 days when stored at controlled cold temperatures. Answer: A. 6 months or the earliest expiration date of any API, whichever is shorter. According to USP less than 795 guidelines for non-sterile compounding, the beyond use date, BUD, for non-aqueous preparations, when no stability data is available, should not be later than 6 months or the earliest expiration date of any active pharmaceutical ingredient, API, whichever is shorter. This guideline ensures that compounded preparations maintain their potency and quality for the duration of their use. Adhering to these BUDs is critical for patient safety and medication efficacy. Question 16. Which of the following describes a black box warning on a medication label? A. It indicates the medication is only available through a restricted distribution program. B. It highlights a severe or life-threatening adverse effect that may occur. C. It signifies that the medication has a high potential for abuse. D. It means the medication is for investigational use only. Answer: B. It highlights a severe or life-threatening adverse effect that may occur. A black box warning, also known as a boxed warning, is the strongest warning the FDA can require for prescription drugs. It is placed on the label to call attention to serious or life-threatening adverse effects that may occur with the drug's use. These warnings are crucial for informing prescribers and patients about potential risks, allowing for informed decisions and careful monitoring, which is a key aspect of medication safety. Question 17. A patient needs to receive 1.5 L of intravenous fluids over 12 hours. The 4 tubing delivers 15 drops/ml. What is the flow rate in drops per minute? A. 31.25 drops/min. B. 18.75 drops/min. C. 25 drops/min. D. 20 drops/min. Answer: A. 31.25 drops/min. First, convert the total volume to milliliters. 1.5 L * 1,000 milliliters per liter equals 1,500 milliliters. Next, convert the total time to minutes. 12 hours * 60 minutes per hour equals 720 minutes. Now, calculate the total drops. 1,500 milliliters * 15 drops/ml equals 22,500 drops. Finally, divide the total drops by the total minutes. 22,500 drops/720 minutes equals 31.25 drops/min. This calculation is essential for setting the correct infusion rate, preventing over or underhydration. Question 18. Which of the following federal agencies is responsible for enforcing the Controlled Substances Act? A. Food and Drug Administration, FDA. B. Centers for Disease Control and Prevention, CDC. C. Drug Enforcement Administration, D. D. Federal Bureau of Investigation, FBI. Answer: C. Drug Enforcement Administration, D. The Drug Enforcement Administration, DEA, is the federal agency primarily responsible for enforcing the Controlled Substances Act, CSA, which regulates the manufacture, distribution, and dispensing of narcotics and other controlled substances. The DEA sets standards for record-keeping, security, and inventory for pharmacies handling these medications. Understanding the role of the DEA is crucial for maintaining compliance and preventing drug diversion. Question 19. A physician requests 100 milliliters of a 2.5% solution. You have a 10% stock solution. How much of the 10% stock solution is needed? A. 10 milliliters. B. 25 milliliters. C. 50 milliliters. D. 2.5 ml. Answer: B. 25 milliliters. This is a dilution calculation using the formula C1V1 equals C2V2, where C is concentration and V is volume. We want to prepare 100 milliliters, V2, of a 2.5% solution, C2, from a 10% stock solution, C1. So, 10% asterisk V1 equals 2.5% asterisk 100 ml. Solving for V1. V1 equals 2, 5 asterisk 100 slash 10 is equal to 250 slash 10 is equal to 25 ml. This means 25 milliliters of the 10% stock solution is needed, which is then diluted with 75 milliliters of diluent to make the final 100 milliliters of 5% solution, an essential skill in compounding. Question 20. A pharmacy technician is stocking a new shipment of medications. Which medication should be placed in a separate, secure storage area due to its hazardous nature and USP less than 800 requirements? A. Amoxicillin. B. Lisinopril. C. Methotrexate. D. Metformin. Answer C. Methotrexate. Methotrexate is an antineoplastic chemotherapy agent classified as a hazardous drug, requiring special handling and storage according to USP less than 800 guidelines. These guidelines aim to protect healthcare personnel and the environment from exposure to hazardous drugs. Amoxicillin, lisinopril, and metformin are not typically classified as hazardous drugs requiring such stringent measures. Recognizing hazardous drugs is critical for ensuring workplace safety and compliance. Question 21. What is the primary purpose of a medication guide, med guide, required by the FDA for certain medications? A. To provide a comprehensive list of all known drug interactions. B. To inform patients about how to dispose of and use medications properly. C. To provide information about serious risks, patient counseling points, and proper use. D. To document the patient's adherence to their medication regimen. Answer C. To provide information about serious risks, patient counseling points, and proper use. Medication guides, med guides, are FDA-approved patient education handouts provided with certain prescription medications that pose serious public health concerns. Their primary purpose is to provide specific information about serious risks, important patient counseling points, and proper use instructions to patients. These guides are crucial for empowering patients to make informed decisions about their health and to safely use medications with potential for significant adverse effects. Question 22. A patient presents a prescription for levothyroxine 100 micrograms PO daily. What is a common counseling point for this medication? A. Take with food to avoid stomach upset. B. Take at bedtime to minimize side effects. C. Take on an empty stomach at least 30 to 60 minutes before breakfast. D. It is an antidepressant and should be taken as needed for mood swings. Answer C. Take on an empty stomach at least 30 to 60 minutes before breakfast. Levothyroxine, a thyroid hormone replacement, is best absorbed on an empty stomach. Patients should be advised to take it consistently, preferably in the morning at least 30 to 60 minutes before breakfast or other medications, and to avoid taking it with calcium or iron supplements. Adhering to this administration timing is critical to ensure consistent absorption and therapeutic efficacy, as inadequate absorption can lead to fluctuating thyroid levels. Question 23. A pharmacist needs to order Schedule II controlled substances. Which DEA form is required for this process? A. DEA Form 222. B. DEA Form 106. C. DEA Form 41. D. DEA Form 224. Answer A. DEA Form 222. DEA Form 222 is the official order form required for the purchase and transfer of Schedule II controlled substances between DEA registrants, such as pharmacies and distributors. It is a triplicate form designed to maintain strict accountability for these highly controlled medications. DEA Form 106 is for reporting theft or significant loss, DEA Form 41 is for disposal, and DEA Form 224 is for initial registration of a pharmacy. Proper use of DEA Form 222 is paramount for legal compliance and preventing diversion. Question 24. A pharmacy technician is asked to prepare 500 milliliters of a 0.9% NaCl solution. How many grams of NaCl are needed? A. 0.9 grams. B. 4.5 grams. C. 9 grams. D. 0.45 grams. Answer B. 4.5 5 grams. A 0.9% NaCl solution means there are 0.9 grams of NaCl per 100 milliliters of solution. To find out how many grams are needed for 500 milliliters, you can set up a proportion. 0.9 g/100 milliliters equals xg/500 milliliters. Solving for x equals 0.9 g asterisk 500 milliliters / 100 milliliters equals 5 grams. This basic calculation is fundamental for preparing sterile and non-sterile compounded solutions accurately. Question 25. Which of the following actions is a direct violation of HIPAA regulations? A. Discussing a patient's medication with their authorized caregiver. B. Providing a patient's prescription history to a new pharmacy at the patient's request. C. Sharing identifiable patient information on social media to highlight a successful treatment. D. Accessing a patient's profile to refill their prescription. Answer C. Sharing identifiable patient information on social media to highlight a successful treatment. Sharing identifiable patient information on social media, even with positive intent, is a direct and serious violation of the Health Insurance Portability and Accountability Act, which of A. HIPAA establishes standards for the protection of protected health information, PCI, prohibiting its unauthorized disclosure. Discussions with authorized caregivers, transfers to new pharmacies with consent, and accessing profiles for treatment purposes are generally permissible under HIPAA. Maintaining patient privacy and confidentiality is a core ethical and legal responsibility in pharmacy practice. Question 26. A patient is taking sildenafil. Which of the following concurrent medications is absolutely contraindicated due to a severe drug interaction? A. Amlodipine. B. Nitroglycerin. C. Metformin. D. Hydrochlorothiazide. Answer B. Nitroglycerin. Sildenafil, Viagra, is a phosphodiesterase 5 PDE5 inhibitor used for erectile dysfunction or pulmonary hypertension. It is absolutely contraindicated with nitrates, such as nitroglycerin, due to the risk of a severe and potentially fatal drop in blood pressure. This interaction can lead to profound hypotension and cardiovascular collapse. Recognizing and preventing this critical drug interaction is paramount for patient safety. Question 27. A pharmacy receives a prescription for Ambien 10 mg number 30 sig. 1 tab PO cus PRN insomnia. The prescription was written on January 1st. What is the latest date this prescription can be filled according to federal law? A. January 31st. B. July 1st. C. December 31st, 1 year from issue date. D. February 1st. Answer B. July 1st. Ambien, zolpidem, is a Schedule IV controlled substance. According to federal law, prescriptions for Schedule III, IV, and V controlled substances expire 6 months after the date they were written. Therefore, a prescription written on January 1st can be filled and refilled, if authorized D, up until July 1st of the same year. This contrasts with Schedule II prescriptions, which generally have no federal refill authorization and may have a shorter fill period depending on state law, and non-controlled substances, which typically expire after 1 year. Question 28. What is the typical storage requirement for insulin vials that are currently in use? A. Room temperature, 20-25 degrees C, for up to 28 days. B. Refrigerated, 2-8 degrees C at all times. C. Frozen until ready for use. D. Protected from light, regardless of temperature. Answer A. Room temperature, 20-25 degrees C, for up to 28 days. Once an insulin vial or pen is opened and in use, it should generally be stored at room temperature, 20-25 degrees C, and used within a specific time frame, typically 28 days, depending on the specific product. This prevents repeated temperature fluctuations from refrigeration that can degrade the insulin. Unopened vials, however, should be stored in the refrigerator. Proper storage is crucial for maintaining insulin's potency and ensuring effective blood glucose control. Question 29. A physician prescribes amoxicillin for a pediatric patient weighing 20 kilograms. The dose is 30 milligrams per kilogram per day, divided into 3 doses. The available suspension is 250 milligrams per 5 milliliters. How many milliliters should the patient take per dose? A. 4 milliliters. B. 6 milliliters. C. 8 milliliters. D. 10 milliliters. Answer: A. 4 milliliters. First, calculate the total daily dose. 30 milligrams per kilogram per day, asterisk 20 kilograms equals 600 milligrams per day. Since the dose is divided into 3 doses, each dose will be 600 milligrams per day / 3 doses / day equals 200 milligrams per dose. Finally, calculate the volume per dose using the suspension concentration, 200 mg / dose, asterisk 5 ml / 250 milligrams equals 4 milliliters per dose. This type of calculation is crucial for accurate pediatric dosing and patient safety. Question 30. Which of the following is a critical component of a risk evaluation and mitigation strategy (REMS) program? A. Requiring patient enrollment in a registry to monitor for specific adverse events. B. Ensuring the lowest possible copayments for patients. C. Expedited approval process for new drug applications. D. Providing free samples to prescribers for initial patient trials. Answer: A. Requiring patient enrollment in a registry to monitor for specific adverse events. Risk evaluation and mitigation strategies (REMS) are FDA-mandated programs designed to ensure that the benefits of certain medications outweigh their risks. A critical component of REMS often includes requiring patient enrollment in a registry to closely monitor for specific severe adverse events or to ensure safe use conditions. These programs can also involve restricted distribution, special training for prescribers, and patient education, all aimed at mitigating serious risks associated with high-risk drugs. Question 31. When converting 1.5 liters to milliliters, the correct conversion is A. 15 milliliters. B. 150 milliliters. C. 1,500 milliliters. D. 0.0015 ml. Answer: C. 1,500 milliliters. There are 1,000 milliliters in 1 liter. Therefore, to convert liters to milliliters, you multiply the liter value by 1,000. So, 1.5 L asterisk 1,000 milliliters per liter equals 1,500 milliliters. This is a fundamental conversion often used in pharmacy calculations for measuring liquid medications and solutions. Question 32. A patient is prescribed both an ACE inhibitor, e.g., lisinopril, and a potassium-sparing diuretic, e.g., spironolactone. What is the primary concern for the pharmacy technician to flag for the pharmacist? A. Increased risk of hyperkalemia. B. Increased risk of hypokalemia. C. Increased risk of hypotension. D. Increased risk of allergic reaction. Answer: A. Increased risk of hyperkalemia. Both ACE inhibitors and potassium-sparing diuretics can elevate potassium levels in the blood. When used concurrently, there is a significantly increased risk of hyperkalemia, high potassium, which can lead to serious cardiac arrhythmias. A pharmacy technician should recognize this potential drug interaction and flag it for the pharmacist to review the patient's potassium levels and ensure appropriate monitoring or alternative therapy. This interaction highlights the importance of comprehensive medication review for patient safety. Question 33. According to federal law, how long must records for controlled substances, DEA forms 222, inventories, etc., be kept by a pharmacy? A. 1 year. B. 2 years. C. 3 years. D. 5 years. Answer: B. 2 years. Federal law requires that all records concerning controlled substances, including DEA forms 222, inventories, and dispensing records, be maintained for a minimum of 2 years. State laws may require longer retention periods, but the federal standard is 2 years. Strict adherence to these record-keeping requirements is essential for maintaining accountability, preventing diversion, and ensuring compliance with the Controlled Substances Act. Question 34. A new prescription for celecoxib 200 mg PO daily comes in for a patient with a documented severe allergy to sulfonamides. What is the most appropriate action? A. Dispense the medication as written, as it is a different drug class. B. Alert the pharmacist to a potential cross-sensitivity and contraindication. C. Advise the patient to take it with food to avoid a reaction. D. Contact the prescriber to confirm the allergy. Answer B. Alert the pharmacist to a potential cross-sensitivity and contraindication. Celecoxib, Celebrex, is a COX-2 inhibitor, and it contains a sulfonamide moiety in its chemical structure. Patients with a severe sulfonamide allergy may experience a cross-sensitivity reaction to celecoxib, making it potentially contraindicated. The pharmacy technician should alert the pharmacist to this potential drug allergy interaction for their clinical assessment and intervention with the prescriber. This proactive step is crucial for patient safety and preventing adverse drug reactions. Question 35. Which quality assurance process involves periodically removing expired or damaged medications from pharmacy shelves? A. Inventory reconciliation. B. Returns processing. C. Reverse distribution. D. Stock rotation and expiration date checks. Answer D. Stock rotation and expiration date checks. Stock rotation involves placing newer stock behind older stock to ensure that medications with earlier expiration dates are dispensed first. Expiration date checks are the systematic review of all medications on the shelves to identify and remove expired or soon-to-expire products. Both are critical quality assurance processes to prevent the dispensing of ineffective or potentially harmful expired medications, ensuring patient safety and maintaining inventory integrity.